First of all, I'm very pleased to welcome Melanie Courtney to speak with us today. Mel, whom I call her Mel, is passionate about the for-purpose sector and has been employed in varying roles within Kidsafe Victoria since 2006, taking on the role of CEO in 2010. She's a Bachelor of Arts, Health Science and an honours degree in psychology, a mini MBA in marketing and brand management, and is currently enrolled in an MBA. She has experience in the disability and community services sector, having worked as an integration aide, volunteered with numerous organisations including the Edmund Rice Camps, the Sudanese Integrated Learning Program and the National Burn Survivors Network. She was the director of the board of Gordon Care when they transitioned to 1020, a venture philanthropic organisation, which I'm sure you all know about because I do. With two very active children, Mel strongly believes that all children have the right to grow up in a safe but appropriately challenging environment. Now, Kidsafe Victoria was established in 1979 as part of the Child Accident Prevention Foundation of Australia. Kidsafe Victoria is an independent, not-for-profit organisation dedicated to the prevention of unintentional death and injury to children through education, advocacy and research. Kidsafe's mission is to make a fairer world for kids at home, on the road, around water and at play. And I have the privilege of being on one of the Kidsafe committees, advisory committees, and I feel very privileged to get access to a range of information that helps me in my job at the centre to think about these issues every day and integrate it into our work. And now today you get to hear from Mel about the work that they're doing and how you can get a little bit more involved. Especially interesting, and Mel may touch on this, is just the implications of COVID during this time. It's been a really has had an interesting but sad impact on the lives of some children here in Victoria. So we'll leave questions to the end of this event, but please write questions in the Q&A and the chat, and we can try and pick them up at the end if we have time. And just to let you know, this is being recorded. If you have any issues with that, please pop that in the chat and we'll try and address those. Mel's going to do an overview of Kidsafe, child injury statistics and some real life stories, programs, e-learning tools and a campaign overview. So without further ado, I'm going to hand over to Mel to take us through her presentation. Thank you so much, Mel.
Thanks so much, Deb. Really appreciate the intro and the privilege of being here. I'd also like to acknowledge the traditional owners of the land, the Wurundjeri people, and recognise their continuing connections to land, waters and cultures. I'd also like to pay respects to their elders, past, present and emerging. Now, in the background, in my background here, you can see the Kidsafe office. We are typically located in the Monash Children's Hospital. Unfortunately, we haven't been there since March due to obvious reasons. And Deb, as you touched on, I will talk through the impacts of COVID on injury because it has been incredibly significant. So I've been at Kidsafe for 14 years, which has been an incredible privilege to see the way that we sort of developed over that time. We do have offices in every single state and territory. I'm really excited to be here today to speak to so many people that are making a difference in the community. I'm a mum of 2 young children myself and know just how challenging that parenthood really can be. I will warn you in advance that I am going to talk about some real scenarios where families have lost their children. So I will warn you before those come up. The reality is, from our perspective, it's a really fine line between a tragedy and a non-event. I guess from our perspective, injury is one of those topics that doesn't often spring to mind until something happens and it's potentially too late. So first-time parents in particular, you know, you're trying to do everything. You're trying to figure out how to feed and sleep and work out how to be a parent. And injury is something that can get lost until something does happen. Most injuries do happen at home and most happen to children under the age of 5, which makes complete sense because it's where they spend most of their time and it's when they really are developing and they don't have that sense of danger and, you know, and homes are not built for children in mind either. So injuries can happen in the blink of an eye, but it doesn't mean that it's something to fear. And that's a message we try and really convey to families. With practical knowledge and support, injuries really are preventable. Now, I'm just going to talk through some of the stats that you can see up on screen here. So at Kidsafe, this is what drives us day in, day out. In a typical year across Australia, over 150 children die from preventable injuries and thousands more are hospitalised. 150 deaths is a huge improvement. It's still a huge number, but a huge improvement from the over 700 deaths we used to see back when Kidsafe was established back in 1979. And we were established by a group of paediatricians that just thought, you know, there's something to be done here. But 150 a week, 150 a year is still 3 children every single week, 3 families that go home without their previously healthy child. Now, just the warning that I talked about before, I am going to talk through some real case studies now, just very high level. I won't go into a huge amount of detail. But those 3 children a week are not just stats. This is 3-year-old Blake Shaw, who lost his life when a bookcase toppled over him in his family's rental property. We know Blake we know Blake's family really well, and you know, as with all the cases we'll go through, they're really good parents, and it's just sometimes not knowing what the risks are. It's 2-year-old Hunter Boyle, who drowned in a dam in his grandfather's farm in August last year, and I will talk in more detail about Hunter shortly. And it's 14-month-old Bella Rees, who died after she swallowed a button battery. If you didn't see her mum, Alison, talk on Australian Story during the week, it's absolutely heartbreaking, but really compelling viewing, and the feedback that they've had in terms of the number of people who are checking their homes for button batteries is just phenomenal. So, you know, if you do get a chance, we really do encourage you to go and watch those. These lives were taken and the lives of their families changed forever in just a split second. The impact of serious injury or death from injury is seriously life-changing. It's a family and grief for the rest of their lives. It's serious mental health implications. It's not just the family, it's the police officers, the paramedics, the nurses, the doctors, the friends, the communities who all have to deal with the impact. And it's community organisations such as yours who help pick up the pieces. But families can and never will be the same, which is why prevention is just so important. Back to Deb's question before about the COVID impact. Now, it's been an extraordinary year, as you know, with a huge range of social, health and economic impacts. For those lucky enough to have kept their jobs, many have been juggling homeschooling, children of multiple ages at home on top of the normal pressures of parenting. Having had 2 children at home myself, 2 young children, I know how stressful that can be. The pressures were reflected really devastatingly in the injury figures. Last year, we saw the highest number of child deaths in Victoria from preventable injury in over 20 years, as well as the highest impact of trauma for burns in the same period. So 25 children died in that 6-month period from the 1st of July to December 31st. That's 25 families ripped apart in just a split second. Almost half of those were drownings, and they were drownings in every single body of water that you can imagine. They were in backyard swimming pools, they were in rivers, dams, ponds, baths, even a pet bowl. And it just takes this amount of water for a child to drown. It just has to cover their nose and their mouth. And they're obviously top heavy, so they do fall in. So it doesn't take much. The numbers don't even take into account the number of non-fatal drownings. So there's quite a significant number of these for every fatality that we see. Other deaths that we saw were caused by driveway runovers, quad bikes, and curtain and blind cords, amongst other causes. Now, we hadn't seen any curtain and blind cord deaths since 2009, when 2 young children in Victoria died. There was a huge response at the time. The legislation was changed so that all new homes, all new curtain and blinds put into homes had to be secured to the wall. And there was also a comprehensive public education campaign, which included free curtain and blind kits provided from Consumer Affairs. So that campaign's still ongoing now, but to not have no incidents in 11 years and then 2 deaths in 12 months, you know, that's something really significant that is something that you can help with as well. Those kits are available freely from our website or the Consumer Affairs website. We receive data at Kidsafe on a monthly basis, so from numerous sources, including hospital admissions, emergency data and death data, so that we can track the issue. We need to stop what occurred last year, and a key priority for us is recognising the disruption to services from the pandemic, which I'm sure you all experienced too. And you know, we've had some great outcomes from that in terms of a move to telehealth and other things that are more accessible for families, but it's also making sure that we are receiving the families that did have babies last year. You know, they didn't have the number of maternal and child health visits. They certainly didn't have the face-to-face visits. And I know for me, when I had my kids, the new parents group was crucial in getting me through what is a really challenging time. So, you know, they didn't have all of those supports in there. There's over 80,000 new births in Victoria every single year, and over 35,000 of those to first-time parents, which means new parents, carers, grandparents who need to know how to keep their kids safe. So what do we do, and how can we help you and families? Hopefully you've heard of us. We do a lot with the community sector, but it's something that we do have big focus on too. We work with the community to educate and empower families and carers to save lives. So we focus on the safety of children at home, on the road, at play, in the water, and around products as well. I'll briefly take you through a few of our programs and campaigns that might be most relevant for you, but feel free to ask at the end about any others that you might be interested in. We're currently partnering with Neighbourhood Houses Victoria to run the government Safe Seats, Safe Kids free child car restraint fitting and checking program, which is supported by the state government. Families can attend an appointment with a fitter in their area and make sure that their child car restraint is fitted correctly. We do have quite a few families that turn up with their child car restraints in the box. We do encourage them to actually have a go at fitting them themselves beforehand so that they can make the most out of the education process. There is a specific website for this, safeseatssafekids.com.au, which you can see up on the screen at the moment. Parents can register and see what events are happening in their area at what time. We will also be having a free e-learning tool that will be launched in the next couple of months. And we do have a dedicated Facebook page as well. You can see a couple of the posts just to the right of your screen there from that Facebook page, which is really handy. The next one that I'll chat about is one that's been really popular with community organisations, and we've run for a number of years. So we provide child car restraint education sessions specifically for community groups. It's a fee-for-service program and it's aimed at staff of community groups who transport children as part of their role. It involves 45 minutes of theory, so going through what the laws are, what the requirements are, but then it has another hour, the rest of the time, an hour and a quarter, is spent hands-on in vehicles in your organisation using child car restraints that you use to transport children to make sure that you know how to use them and what to do. And part of that process too, we are talking to organisations about getting some sort of consistency with the child car restraints that they do use. So, you know, that when you do have new team members, it's much easier to train them. We also, and sorry, I should say the first 50 of those we provide each year are subsidised through the Victorian Road Safety Grants Program, which I've totally got the name wrong for that. So apologies, anyone who is listening and knows what it's called. You can find out more information on our website. We also do run a 1 and 2 day accredited child car restraint fitting course. And so that's to become an accredited fitter. We don't recommend that anyone ever just does the course and thinks that they're an amazing fitter, because there's so many different combinations of cars and restraints out there. But we do have a number of community organisations that have sent 1 or 2 staff members to come and complete that, so they do have more in-house expertise to assist with less experienced team members. The big one that we've developed recently, the big resource for community organisations, again specifically, is an e-learning tool. So we do have a version of this for maternal and child health nurses, and we've had hundreds of them doing that over the COVID interrupted lockdowns. But we did develop one for community organisations as well. We've tried to tailor it so that, you know, if you do transport children in your organisation, you can do that specific section of the tool, but you don't have to do it if that's not relevant for you. So you can see from the screenshots here that it takes you through the various safety issues broken down into home, road, play, water and product safety. So this tool is available at no cost, and we are recommend no cost until the end of the financial year. So it was developed with a grant from the Helen McPherson Smith Trust, which we were really grateful for. And there will be a small cost that comes in next financial year just to enable us to continue to keep it updated. We are encouraging community organisations to get every single member of your team to do this. It's a really easy way to upgrade your injury knowledge and make sure that you are up to date with what's happening. And we also plan to develop an annual refresher so that we can give you up-to-date statistics. So what's happened in the last 12 months, for example, information about emerging issues and key resources. And you do receive a certificate at the end of that. So again, there's more information on our website, and I think we basically sign organisations up as a whole, and then it's really easy to register individuals. The next one that I'll chat about briefly is National Burns Awareness Month. So we run this every year on behalf of all Kidsafe states and territories, and that runs in June, which is the start of winter, and typically when we see a significant number of burns. Probably the key take home from this, apart from there are a huge number of websites, resources on the national website, just to be confusing. Sorry, the kidsafe.com.au. We do have a few on the Vic one, but most of them are on the national website. And the key take home from this probably is, download some resources. There's some for kids as well as for parents and for staff. But we also do have a grants program to go with this, and it's a very small grants program. We offer $500 or $1,000 to community organisations or other not-for-profits to promote an activity during the month. So there might be something that you want to do at your centre, or you want to work with, or, last year we had people paying to get St. John to come in, for example, and deliver some first aid courses on how to treat a burn when it happens. There's all sorts of things that you can do. So please do. We haven't launched them yet. We will be launching those probably around the end of March, but please feel free to touch base if of interest. Now, in terms of our overall resources, you can see here we've got, this is just a snapshot of what we have. So there's a huge amount online. We run a pool safety competition, driveway runovers, button battery information. Home safety checklist is our most popular resource, and it's just an easy one. I think we do a lot of presentations where we go out and talk to new parent groups, and it can be a huge information overload. So having a checklist to be able to give to them at the end and say, go home and just go through this and check your home for what's safe is a really great resource. We have do not leave children in cars signs for car parks. We have an Aboriginal resource kit, which we are just about to update, safety for our little fellas. So that's it's a flip chart which has got images on the front and content on the back for you to read through when you're talking to families. And that is also accompanied by a set of posters and fact sheets. So you can order most of our resources. You can either download them for free or order them for the cost of postage. I will quickly mention our farm safety competition too. So we've just launched that. We did run it last year, which was a very interrupted year, obviously, for schooling. But it's a school competition where we get the kids to get involved and get creative about farm safety. And it's pretty amazing to see some of the things that they do come up with. Excuse me. In terms of other content, so we do have an e-news as well, which is you can subscribe to. It's got it goes out monthly, and it provides tips and product recalls and other things like that. So one of the key points that we make, I guess, and I'm not going into detail on this presentation about every single area of injury because we'd be here all day, but it's in collaboration with organisations like yours to empower families to spot the hazard, work out how to deal with it, because that can be challenging sometimes. And the most important part is to make the changes. So not tomorrow, not when they have time, but now, before it actually matters. And this is where staff of community organisations can be so critically important. You're often the only external professionals who are able to step inside the home of vulnerable families and assist them to identify and find means to address the hazard. So any way that we can help you do that, that's what we're here for. One of the other programs I'll quickly touch on, and we only established this late last year as a result of really a huge number of deaths, as we touched on, but we work with a lot of the families who either do lose their children or are impacted by serious injury. So I guess, our role has typically been about prevention, but we also know that prevention, treatment and recovery are so completely intertwined. So we developed a new program, the Ambassador Program, which supports families who've been touched by death or serious injury to tell their stories in a meaningful, impactful way. That program is managed by an absolutely wonderfully skilled and empathetic bereaved mother, Alex Hamilton, who lost her son River to SIDS just over 9 years ago. So she started with us last September, and that program is yeah, already doing amazing things. And I'll go through an example in a minute. But I guess if you do know of families who've experienced serious injury or the loss of a child who might be ready to share their story, feel free to touch base with us directly. We have also created a Facebook group for families so they can support each other. And we're developing a collaboration with the Compassionate Friends Victoria so that we are able to better support ongoing needs of families, which we know, it's just such a challenging thing to have to deal with. One of the specific programs that we've been working through as part of the Ambassador program is the Hunter Boyle swimming program. So you would have seen Hunter's beautiful face before. As I said, he lost his life in August last year when he drowned in his grandfather's dam. Just 2 days after they buried Hunter, another child drowned just less than 2 hours from Ash and Matt's regional property. Ash reached out to see what she could do to make sure that no family has to go through what is their new reality every single day, which is just, still just so selfless and amazing. I had the privilege of spending some time with both Ash and Matt, Hunter's parents, late last year for the first time in Shepparton, and it's just impossible not to feel their pain. Yet they're raising funds as part of the Hunter Boyle swimming program to provide vulnerable children in regional areas with free swimming lessons. Pretty incredible. Not only is the thought and the intent incredible, but they've actually raised $25,000 over the last few months. And we've got 20 children in Shepparton who are going to be having 12 months of swimming lessons, as well as the education that accompanies that, and the swimming gear, all of that's included as well. We're really proud to do that in collaboration with The Bridge, a community organisation in Shepparton who's in charge of the referrals and will provide support for parents to attend as well. So, just such an absolute tragedy, and for his parents to create such an amazing legacy. We're really proud to be a part of that. So where to from here? So we think that the spike in serious injuries and death will continue unless there's some urgent investment in the area, which is something that we're working on at the moment with government. Parents are exhausted. It's been a really tiring year, and that ongoing fatigue is a real issue, as I'm sure those of you who are working parents would appreciate. It's not just that, it's also that kids will be home more frequently. I actually thought that my youngest was going to be home today because she had a little bit of a cough yesterday. A sniffly nose is enough to keep them away from school, kinder or daycare now. In years gone by, I know in my case as well, grandparents would potentially help out on those days, which seems a little terrible and negligent now, but instead the kids are likely to be at home, potentially again with a working parent or juggling children of multiple ages, which is why a safe home environment as well as appropriate supervision are critically important to keep kids safe. One of the particular concerns we have, and I touched on this a little bit before, is the first-time parents who had babies last year. They've had little contact with the MCH nurse, possibly no mother's group to support them. From a safety perspective, the injury prevention content is usually delivered by maternal and child health nurses as one of the session's 2 new parent groups. So those children are going to start getting mobile now for the next 12 months, depending on when the bubs were had. So crawling, walking, which brings around a new set of hazards. If parents are not properly equipped to deal with those, or they're not aware of them, then kids are going to be spending a high proportion of time in potentially unsafe environments without even knowing about it. This is where you can play a huge role. Everyone on this call has a key role to play in prevention. For those of you who are on the ground in families' homes, or even conversing with them via video, you can help them spot any hazards and work out how to address them. Another role that you can play is around storytelling, and some of these stories aren't nice to hear and they're not nice to tell, but it's usually hearing stories that resonate with families that make them take action and change their behaviour. So it's sharing stories and encouraging families to share those. And it's also sharing the near misses and the lucky stories too, not just the ones with the incredibly sad endings. The more we talk about it, the more people realise that it can happen to them, but it is preventable. I remember when we released Blake's story about furniture tip-overs, we had thousands and thousands of families tagging each other in social media, saying that they needed to affix their furniture so it wasn't a hazard. It's stories like that that make a difference. We need to remember those 35,000 first-time parents in Victoria each year that may not have ever heard these messages before. people don't tend to take notice of stories until they're relevant to them. So as a parent or carer, while we get those messages out there every year, it's not relevant until it is. And in an era where we have information at our fingertips, one of our big challenges at Kidsafe is to cut through the noise and to create impact through stories, because we're competing with so many other stories out there. We do, and one of the things that we're trying to do is also be really creative about the ways that we do get through to parents. Instead of saying do this and don't do this, it's being creative and capturing their attention. I'm going to completely tempt fate now and ask Gretch, who is doing a beautiful job with the slides, to actually play a video of a creative campaign that we ran a few years ago, which is still one of our absolute favourites. Hopefully it works. It did when we practiced. So Gretch, do you want to give it a try?
Hi guys, here I am on the iconic Bondi Beach, and in a few hours I'm going to be launching my new unconventional oven, and I've invited some press and media to come along. Now, they're expecting a normal food demonstration, but I've got something far more important to show them. Guys, welcome to the launch of my new unconventional oven. This oven heats up in minutes. It stays consistently hot. It produces amazing results, and it maintains a perfect temperature throughout. Now, what we're going to do is a beautiful lamb loin. I've got that actually cooking in the oven as we speak. I'm just going to get the rest of the plate ready, and then we're going to serve it up. We're going to have pine nut dressing. Now, this is freshly made harissa, and we've got some shoulder here, and time now to unveil my oven and grab my lamb. That's a nice piece of lamb loin. I reckon it's going to take about an hour and a half to 2 hours. Now, like I said, it's an unconventional oven. Now, this has been in there for a little over an hour and a half. Now, look at that. To me, that is overcooked. Now, guys, the real reason I've got you here today has got nothing to do with me launching my oven. It's all to do with 5,000 kids have been left in cars every year. And as a father, I was absolutely gobsmacked. I couldn't believe it. And I think Australia needs to know that it is not safe at any point in time to leave a kid in the car. It is like an oven. Hi guys.
I've seen that video hundreds of times, and I still love it. And for us, it was just looking at a creative way of getting across such a simple message, which is what we need to do repeatedly. We're really excited at the moment because the creator and the producer behind that video, who's a father of young kids himself, reached out to us last year to try and do something about the current number of incidents. So we're developing a new campaign with him, which we hope will make a difference to the current numbers. What else can you do? Any opportunity for education is critical. So if you have a family come in with a child under the age of 5, one of our favourite tips for families is to get down on the floor and crawl around, if it's safe to do so, obviously, and look at the house from a child's perspective. You know, where we do see danger, they see magic and opportunity. It's up to us collectively to equip families with the tools to recognise and address the dangers that are there. Make safety a priority. Talk openly with families about it. You can make a huge difference. At the end of the day, we're a small not-for-profit organisation who needs the support of organisations such as yours to do our job effectively. We know that kids will be kids, and it's our role to protect them. It's making sure that children are able to be curious and safely explore, grow, develop and push boundaries, but do that within the safest environment possible. At the end of the day, we can't stop kids being kids, but together we can keep them safe. Thank you so much for the time to be able to chat, and hopefully you've got some questions. If not, you can always follow up with us afterwards. But that's all that we have prepared to go through today. So thank you.
Thank you, Mel. Thanks for that really interesting and thought-provoking discussion, and that video definitely impacted on me. I've got 3 children myself. I'm just wondering if there are any questions from the participants, from the audience. There was one from Joe from the centre regarding resources. We can definitely forward the resources and links to resources that you think are most relevant for community service organisations and carer peaks. So that's something that we can facilitate here at the centre. I'm wondering if you've got any other suggestions for staff on the ground about where they, I mean, you did touch on it in the presentation, where they can access resources, or where they can direct families to find things that might help.
Absolutely. So we have a huge number of resources on our website, and we do have an order form as well for community organisations. So like I said, most things are available either for free download or for the cost of postage. So we're happy to put together just a specific flyer for community organisations to send out with some key resources.
That would be great, Mel. That would be fantastic. I mean, we can also pick some stuff off your website and put some stuff on ours as well. There's lots we can do. And I think that, you know, your call out to say, look, if we can just, I mean, we can't have happen last year happening this year. Those numbers are really upsetting. And I think that with all of the environment that we're in, where there's lots going on, there's lots for people to be concerned about, it is hard to cut through. So it is up to us to try and find ways to do that. And we do come in contact with lots and lots of people. And I think this information it's nice and digestible. So I think that it will definitely, Jo Humphreys is on there. She just wants information for grandparent carers, I know, and carers. So she'll get it out. But have we got other questions from people? I mean, I've got a ton. Happy for people to put them in the chat or in the Q&A. So Mel, maybe I can ask you a few questions while people get a bit warmed up. So in terms of the first few months of this year, I know that, again, I have the privilege of listening to a lot of this information on the committee, but there has been a surprise, hasn't there, that the end of 2020 occurred and that we've gone into 2021 and it actually hasn't stopped. We're seeing a bit of a continuation of the trend. Do you want to talk about that a little bit? Because actually the paediatricians at the hospital are saying they're not surprised that actually we've seen the continuation of some of the patterns that we saw in 2020 around injuries to children.
Yeah, unfortunately, that's correct, Deb. So I think we first became alarmed back in August when we had 8 children in 6 weeks who died from preventable injuries. And we did a big media blitz at the time. And then obviously the lockdown lifted later in the year. So we thought that those numbers would subside. But, you know, the December numbers were horrendous. And we've got the January numbers in terms of trauma from burns, which are also incredibly high. So, you know, from our perspective, we think it does go back to that parental fatigue that we touched on earlier. It's been an exhausting year, and also knowing now that there's a lot of families that haven't received this information. And, you know, like I said, injury is not something that comes to mind for a lot of families. It's not necessarily a priority, and until something happens, and that something happening can be something really minor in the end, that, you know, they can go, okay, now I'm going to fix the TV to the wall and the curtain and blind cords, and I'm going to do all of these things. Or it could be something incredibly tragic that just changes their life forever. And what we're hoping to do is, you know, talk to like these groups like you have here on this call to say, like, we just need to be talking about this regularly and making it as simple as providing a home safety checklist to a family. Something that I didn't touch on, which I might just briefly, if that's okay, is in terms of fatal sleeping accidents as well, because I think that that's probably a really key area for a lot of community organisations. So there's obviously the best practice red nose guidelines in terms of safe sleep, but we have seen so many deaths over the last number of years, which we would term fatal sleeping accidents, and that's a preventable death from sleeping. And it might be, you know, we had one last month where a family went to visit another family and they had the bub on the bed, with, you know, surrounded by pillows, and checked on them vigilantly every half an hour, and that child unfortunately suffocated. And there's been quite a number of those as well. And some have been, you know, due to parents just being really, really tired. So it's something that we've seen across the board. And I should say that all the numbers that I did mention exclude SIDS cases and fatal sleeping accidents. So the picture's actually a lot bigger than what we did paint.
So Mel, it's that co-sleeping, isn't it, with little bubs, where there are all sorts of guidelines and don't do it, and that are becoming a ongoing problem for all of us to be able to educate parents.
Well, it's a really tricky space because there are, you know, ways of doing it more safely, and, you know, for a lot of families, it's a cultural practice that's just embedded, and it's what they choose to do. So, you know, I think that there's just got to be more conversations about it, and more awareness of, okay, if you are going to do it, what are the factors that you need to consider? And, you know, if the baby's a prem baby, or if it's sick, or, you know, if there's other factors, you know, parents under the influence, or really tired. And, you know, I don't know what parent with a young baby isn't just completely exhausted.
It is exhausting. I
mean,
mean, I had mine in bed with me, so, you know, it's not, I mean, I think it is a common practice, but as you say, it's about how you can do it safely and being really aware of that. But it is still, you know, one of those things that we need to work on, and not assume that we've solved some of these issues.
Absolutely right. And just to touch on some numbers that are public, because we're not allowed to mention the ones from the last sort of the more recent ones, but, you know, in 2017, there was the Mother, Baby and Children's Report, and there were 21 babies that died from fatal sleeping accidents in that year. That's a huge number of families, just, again, forever impacted. So I think, you know, it is important to have the conversation and make sure that, you know, it's not just something that people are hiding and doing because they think it's taboo. You know, have the conversation and work out the key points, I guess, for each family, which may be different.
Yeah, that's right. It is about it, to be honest, every family circumstances are different. And as you say, the cultural norms that play in your family mean you do certain things. So it is about getting access to, I mean, even it is really obvious that not having a lot of our mainstream services in place, our maternal child health nurses doing face-to-face work, has had an impact, because almost everything went to telehealth. And so now playing that catch up. And I think for a lot of the people on this call who are working with very young mums and little tiny bubs, I think there's something we might need to do in that space to sort of alert our agencies to sort of be thinking about this as they're visiting, because we have lots and lots of family services workers visiting lots of really young families. So we might be able to do something in that space, Mel. Now, we've got something in the Q&A in relation to carers. Can the webinar be made available on their website? Happy to talk to you about that, but we might need to do something a bit specific around carers, as that we might talk to Mel about, that might be a bit more targeted. So watch that space. And that's the one that's in there. We've answered that one. So any other, sorry, Georgette,
I have a question. Look, Mel, I'm just wondering, are there any particular things that, or signs that might place some families or some children particularly at risk, that our workers who might be going into a home visit might look out for, or some red flags that you know, that they might need to keep in the back of their mind, that might prompt a safety discussion with the families?
One of the tricky things about injury is that it doesn't discriminate. It does happen to everyone. You know, kids are, like I said before, kids are kids, they're mobile, they're curious, especially as they go through those different developmental stages. So I think in terms of having the conversation with families, it might just be as simple as having that home safety checklist to start with. And you might pick up on okay, there's a kitchen that's not gated off, you know, that kids can, the kitchen is one of the most dangerous places in the home, because burns and all sorts of things can happen there. So it might just be little triggers like that. You know, maybe picking 1 or 2 questions, which again, we're really happy to help with from the home safety checklist for you to ask families. And if they don't know the answer, if they hadn't thought about it, that's the starting point.
Great question, Georgette. It is one of those things where you want, you know, you actually, the environment's different, you know, the numbers of children, but there are some things that I think, you know, if you think about being at home, lots of families have been at home in the last year. It does seem from what Mel's saying that, because we were so used to children going to schools and those other larger environments where they really do focus on children's safety. I mean, it's part of what they do, whether it's physical, emotional, psychological safety, but actually we've not really thought about safety in the home in the way that perhaps we might have otherwise. So no judgment here, but in fact it's been very intense time for families, very intense and very challenging. I mean, a lot of the people on this call here have worked and had children at home for almost a year. So it's been really, really difficult. And I think now we've got to think out how we can support those families should we end up particularly back in that space again. Fatigue as well. Well, no, I mean, I think we just need to plan just for the plan to, now we're on this and we're talking about safety at home, keep going in the event that we're back there again. But Mel, you talked about fatigue. I mean, many of our families are just so tired from having new babies, but also tired from COVID. And clearly that's playing a fairly significant role in some of the preventable injuries that we're seeing.
Well, it is, and potentially not having those support systems in place either. You know, if they haven't had a new parents group or if they've potentially met virtually, it's very different to being up in all hours of the night and being able to send a WhatsApp message or a text or whatever to your mother's group and actually have a response as well. That you're not alone and that other people are going through that too. So, you know, I know from our perspective, like face-to-face, we normally have obviously families come through the hospital, which it's quite interesting because the families that usually come in are the ones that are not necessarily seeking our information. They just happen to be at the hospital, they see us there and they come in and are really surprised to have the chat and go away with a whole host of information. But, you know, there's normally baby expos every year. We normally see 20,000 families or first time or expectant parents across those 3 days where they have a statewide baby expo that, you know, like where are they getting their information now and what sort of information are they getting in that incredibly crowded space? So yeah, it's definitely, it's a really tough time for families.
And it is interesting because actually we've probably shifted a lot more to sort of the digital safety in a way, and so yeah, we need to just get that balance right in these conversations. So look, I can't see any other questions in the Q&A in the chat. I think people just want to grab your information and just get it out there, Mel, by the look of the sort of questions, which I think is fantastic, that the information is that you provided is so clear. But we might need to have a chat with you about some other sessions, if that's okay, particularly with carers and some of our family workers, because I think we really want to get this information out this year and prevent some dreadful situations happening to children and their families here in Victoria.
Yeah, I was just going to echo that, and also we could definitely facilitate some additional sessions through the centre, but you also conduct sessions directly to organisations. Is that right? Is that my understanding? If particular organisations would like something a bit more targeted to them?
We do at the moment on a fee for service basis. So it's a very small fee, but obviously we are so pressed in terms of we've got a very small team and we are a not-for-profit. So yeah, we can absolutely do that if there's not resources available on the website.
That's lovely. Yes, we know, we feel your pain, Mel. We feel your pain. It's the same everywhere. Now, look, if there aren't any more questions or comments, we're going to wrap up. We're 15 minutes early, but that doesn't surprise me. We got such a comprehensive presentation from Mel that we're just eternally grateful. We will now work with you after this session to get all the information out there up on our website and distributed through all of our updates, but we might come back to you with a couple of more targeted ones for some of our other groups like our carer groups as well, if that's okay.
No, that sounds great. And I did just see the comment or question that someone had around cold resources.
Yes.
So we do have a number of translated resources on our website at the moment, our ages and stages fact sheets, but we are also in the process of going through a huge revamp. And we're trying to, there's so much content in some of our resources that we are trying to make them appropriate in terms of low literacy. And we do have that Aboriginal resource kit that I mentioned as well, which is largely image based. So there will be more to come on that in the next few months from our end.
That's great. And if there's anything we can collaborate on that might be for a specific sector, let's talk about that as well, where we can, put some of our own resources into that. So just let me know, and I'm sure Georgette would want to work on that as well. Thank you to everybody for coming today. I hope that I'm pretty confident you've got information in a format that you didn't have, and some of the statistics that you've been provided with have shocked you. And that's, is a good and a bad thing. But I just want to say thank you for coming today. The information will be on our website. There's lots of stuff that's going up on social media as Mel's been presenting, which I think is fantastic, so that people, our supporters, because we come in contact with lots of people, are seeing and reading that. And we will also, you'll hear more from us in relation to some more targeted sessions that we'll probably do with Mel over the coming weeks. So thank you, everybody. Thank you, Georgette. Thank you, Mel. Thank you, Gretchen. And thank you, Christy and Bronwyn, for helping us with the technology.